everybody. Thank you very much for joining us today. My name is David Griffith. I'm the Director of Programs and Outreach for the LGBT Elder Initiative. And our program today is, thank you, John, thank you. You as well, John. Our program today is Care for the Caregivers, Resisting Isolation and Improving Self-Care. So one of the things we hear a lot about is, not only within LGBT communities, but for all people of all ages, that caregiving is a big issue. Not only for the person being cared for, but also for the caregiver themselves, who has to deal with a lot of the stress, a lot of the navigating the system to find resources for the person they're caring for. And we also know, especially within LGBT communities, that caregiving can look a lot of different ways to a lot of different people. That you could be caring for parents, you could be caring for siblings, you could just be caring for a friend or a neighbor. You could be a live-in caregiver doing this 24 hours a day, 7 days a week. You could be one of many caregivers supporting a friend, a neighbor, an extended family member. So we're going to explore all those issues today. We have a couple of presenters, a little bit about how today is going to work. We're going to hear a presentation about caregiving, caregiver stress, some of the tools for caregivers. We're going to have a presentation on some of the resources that caregivers can take advantage of. And then for the latter part of the latter portion of today's program is going to be more discussion-based. So we'll be talking in small groups. We have some discussion questions to really be able to hear from all of you about why this issue is pertinent to you, what some of your experiences have been, what some of your thoughts are for the future. And then bring it all back and share some of what we can take away from the program. And then at this time, I would like to bring up Serena, and I will let her introduce herself further. But Serena is with the CARES program at Lutheran Settlement House, and she'll talk a little bit more about what that means. And has also been really instrumental in our committee putting this event together today. So please give Serena a warm welcome.
Good morning, everybody. So thank you for coming, and I think you get a special commendation for coming to a program on social isolation. So you're already doing your first step in combating that, and also for being inside on such a beautiful day. So, and if at any point anybody can't hear me or understand me, please let me know before I blow through everything. All right. So my name is Serena Eisenberg. I work with the Caregivers Reducing Stress program, and this comes out of Lutheran Settlement House. And the way that this program was started was looking at, in order to keep older adults living in the community independently, there comes to be a point where everybody needs some help, and that's really only going to happen if there is a family member that's willing to help them, which is ideal, right? Or some type of private professional care. And of course, we want to be cared for by our loved ones. And for the most part, I think our loved ones want to care for us, but it can be tricky. So it's also a very isolating experience. And I think a lot of times people don't realize that there's so many other people that are going through the exact same thing that they are at the same time. So, I mean, the numbers are pretty incredible. So over 34 million Americans provide unpaid care to someone over the age of 50. So the overwhelming majority of care is being provided by unprofessional caregivers. So whether it be biological family members, members of the community, friends. Out of this 34.2, 15.7 are caring for someone with Alzheimer's or some other type of dementia, which comes with its own kind of special set of challenges. And what's particularly interesting for us today is that more LGBT people end up being family caregivers than the rest of the population. So, for the Caregivers Reducing Stress program, we offer an individual counseling, so that way everybody gets this time to really focus on what it is that's causing them stress, and talk with someone that is trained to connect them with resources and handle some of these symptoms. And we work with anybody that is caring for someone over the age of 55 who lives in Philadelphia in a non-institutionalized setting, who has a non-professional relationship. And so in addition to the individual counseling, we do also do family support groups and family sessions and support groups, and also advocacy. So if you have any questions ever really about how to get resources or find out things related to being a caregiver, please give us a call. Okay. So as I was saying before, we often say that the two terms that are used interchangeable are family caregiver and informal caregiver. And these both have various connotations that kind of various people have disagreements with or don't identify with. So just wanted to clarify that when I'm saying family caregiver, it's an adult family member, another individual, who is an informal provider of in-home care to an older individual. And so, once again, that has nothing to do with one's biological family, one's legal family. This is just about if you're caring for someone that you care about. So just to get a sense of the room, does anybody, so raise your hand if you know anybody over the age of 55. Okay. Have you helped this person so keep them up. Have you helped this person to do something that they might not have, that they used to be able to do on their own, but now have trouble with? Have you ever been worried about them? Have you ever been frustrated by them? Yeah. And keep them up if you've ever put their needs in front of your own. So also when we're talking about LGBT, elder caregiving, this encompasses a very wide group. So we're talking about LGBT adults who are caring for non-LGBT adults, LGBT adults that are caring for other LGBT adults, and non-LGBT adults who are caring for an LGBT older adult. That was a mouthful, sorry. And in general, when we're thinking about what does it mean to kind of age well or age healthily, falls into three very generic categories. So we're looking at economic security, social and family connection, and also one's physical, mental, emotional health and well-being. And for LGBT older adults, all of these come with their own set of challenges. So with with economic security, there's often ongoing discrimination. So people don't have the same finances that and haven't planned necessarily in the same way. Often there's a disconnect from legal, biological family, and these relationships might not be recognized in the same way, the informal relationships, and that presents a whole set of challenges. And there's also a lack of competent and inclusive health care, as well as higher incidences of chronic illness. So kind of going more specifically into these challenges, so looking at physical health, there are higher incidences of people missing doctor's appointments. They're less forthcoming with their providers about their status or sexuality, various dietary changes, inconsistent sleep, particularly when it comes to caring for someone with a dementia and they're wandering or they're not sleeping through the night. There's less time to exercise or less ability to necessarily get out of the house. Talking about discrimination in healthcare is really important. There are lower rates of health insurance coverage, and LGBT older adults are 5 times less likely to seek medical or other type of social services than non-LGBT adults. And legally, actually, we're going to do another workshop in May that's going to really cover a little bit more about the some of the legal issues and information. But as a quick overview, so we're talking about planning forward estate plans and wills. There's a great disparity in Social Security benefits. So if you're with your partner, not necessarily being eligible for the same benefits that others are. And also when it comes to long-term care, at whatever point people transition out of the community, their own home, there is a lot of fear about what it means to go into an institutionalized setting. And so we're going to go through a lot of not particularly, how do we say, warm statistics, but it's going to end on a more positive note. So there are also all these social challenges when it comes to caregiving as an LGBT adult. So the communities that people turn to, so often we're feeling ostracized from religious institutions and other various community services, being estranged from biological legal families, feeling like support systems have dwindled over time. LGBT older adults are twice as likely to live alone, twice as likely to be single, 3 to 4 times less likely to have children, and feel less welcome going into the into various services and social events. Financially, once again, we're talking about less likely to have long-term care insurance, and feeling really unexpected and unprepared for the future. And then with all caregivers, there's a whole set of really complex emotional challenges. So what does it mean to be a child that's caring for your parent, right? This is the person that has supported you, that has loved you, that is ideally. And now those tables are flipped, or even for partners, right? When you come together, there's a certain evenness in what you're providing one another, and all that gets really, really flipped. And that can lead to a lot of resentment and guilt, depression, anxiety, concern for your loved one. And as you spend more time caring for someone else, it means obviously that you're spending less time caring for yourself. And this idea of who you are and who you were can often get lost in that whole caregiving role. And all of this leads to what is often called caregiver strain or burnout. Has anybody heard that term before? So what is it? What have you, when you've heard that term, what do you think of? Or when you think of someone who has gone through this or embodies this, what do they seem like?
They seem like they wanted to quit the whole situation.
Yes. Just like, get me out of here, right?
This is like hell.
Yes. Right on.
Yeah.
Utterly exhausted, just like end of the rope, right? Mm-hmm.
Emotionally detached, actually, and even cynical.
It was a really, really good observation. And that very much feeds into kind of this social isolation. So not only are people physically detached, they're less engaged with the things that they used to be, but that then makes them feel disconnected, and that makes it harder to then re-engage and connect with people.
Serena? Serena?
So caregiving doesn't necessarily have to get...
One other thing I wanted to mention, I don't know whether it's in this situation, but in classic burnout, there's also a feeling that you're not doing a good job.
That's a very good point. Yes.
I don't know whether that's in...
No, I think
informal
you're
caregiving.
absolutely right, and that's where that guilt comes in, right? Where you're giving so much of yourself, but you somehow feel like it's never quite enough.
And if the caregiving is someone who is aged, there's a thing that this is not only not going to get you better, this is going to continue to get worse.
And that's one of those prime distinctions between caring for a child and caring for an older adult. That for the most part, right, when you're caring for a child, yes, you're going through some of the same, right, you're not sleeping, you're constantly anxious and worried about their care, but you're also seeing them grow, right? You're seeing them become this whole new person and figure things out. And there's a certain joy and optimism in watching that growth. But how do you put all of that love into someone who sometimes is not giving that back to you, and who, you know, pretty much, right? I mean, we're all headed in the same direction. So we all know where it ends up, and I think it's really hard. And it's really hard to look at the person, you know, that you love, and to see someone suffering. All right, so kind of transitioning now from talking about caregiving specifically and loneliness and isolation. So once again, have you raised your hand if you feel like you've just ever been in this place where just nobody understands? Where nobody understands, they just don't get it. Oh, actually, that's impressive. Okay. Raise your hand if you feel like you've needed assistance and there wasn't someone to call. And raise your hand if you've ever felt alone in a room full of people. All right. Well, hopefully not right now. So, and often you'll see, especially when it comes to research studies, there's this interchangeable use of loneliness and isolation, and there is a distinction. So when we talk about loneliness, that's the feeling of being alone, right? So you can feel alone when you're in a room full of people. And isolation is the state of being alone. It's physically being in a place where there are no other people. That makes sense to everyone? Okay. So a third of older adults across the US self-report to be lonely. About a third of Americans older than 65 live alone, and half of those over 85 do. And this has definitely been growing over the years. So social isolation has doubled since 1980 from 20 to 40%. So this is an ongoing, persistent, and growing problem. And the problem with social isolation, right, is that it has many physical consequences. So looking at it, they found out that its impact is the same as smoking or obesity when it comes to diabetes, heart health, strokes, early mortality, cancer, and that there's a very, very strong correlation between isolation and dementia. And where it's also becoming this very costly part. So in hospital expenses alone, so looking at all these consequences, they found out that it's costing almost $67 billion annually. And so that isolation is about $1,700 per adult. That's what it ends up costing in terms of healthcare. So this year, so as we were talking about it has become a more global epidemic, and the United States is somewhat notorious for not caring for its older adults and not kind of having the same community feeling and caring for one another as other places. And so when I was going with the stereotype of the British, where we imagine it's gray and it's raining and everyone's sort of quiet. But I love this, that they appointed a minister for loneliness a couple of months ago, and they have a national campaign to end loneliness. And the Prime Minister referred to this task as tackling the sad reality of modern life.
I have a question about that.
Yes.
I'm sorry, the logistics on that, is that because of the high rate of suicide that's happening, or what?
That's a good question. For what I've read, that hasn't come into play. That doesn't mean that that's not. That it's looking at who is residing alone, who feels like there is somewhat. So I think a lot of it is. So there's the quantitative part of looking at just how are people living, and then there's qualitative, which is their experience of it. But I will look into whether suicide is coming into those numbers. That's a really good question. So kind of as we've gone over that LGBT older adults and caregivers are more prone to social isolation and caregiver strain. There are various, so when we're looking, okay, so now what do we do with all of this? And it, as we point out, it's hard to age, right? We become physically less mobile. It's harder to get places. It's harder to connect with one another. Also, our social circles are diminishing, right? People are getting sick. Some people, right, they end up out of the community or in various institutions. And so part of this is trying to say, okay, well, we're all prone to it. So when we're in that situation, what are some of the steps? Who is it that we can reach out to? So this is all very small. So all of these resources are over on that table there. So don't feel like you actually need to be able to read this. So there are local resources. There are also online resources. Actually, that's a good question. So how many people, when they are looking to engage with something or find out information, go online? Okay. And how many people physically try to go to the place or engage personally? Okay. That's pretty good. So some local resources. So there are CARE. So if you are a family caregiver of an older adult and you want to talk to somebody, please give us a call. So that's me and my colleague Destiny over there. There's also PCA's has a senior companion program. So that is a two-pronged approach. There's so if you are an older adult with a lot of energy who wants to give back, you can be a senior companion. And if you are an older adult that is isolated or homebound in some way, you can have someone come out to you. So it's not home health care, it's not nursing, it's really just having someone with you who can also help you with things. And what's great about it is that it's free for the person receiving the services up to 25 hours a week. And for those that are being the companion, it is essentially volunteering. They provide a very small stipend and transportation reimbursement and things like that. But for people that live in Center City, there is a program out of Episcopal Community Services called Communicare. Has anybody heard of this? So they also match up community members with homebound or isolated older adults, and it's a free resource. They're very good at finding, a connection, finding people that are going to get along and enjoy one another. So if you're interested in volunteering or in having a companion, and you live in Center City, I recommend that one. And then the library, I don't have that one, which is one of my favorite spots. So for both going, it's a great place to just go because they're open and it's free and there are tons of resources. They also have a lot of programs. But for those that are unable to possibly get out of the house, they also have services to bring books and CDs and videos to homebound adults. So if you can't get to the library comes to you. Online, there's a world of resources, but this can also get a little overwhelming. So Meetup is one site, and so if you have the idea is that there are a lot of people who have interest in things but don't necessarily know how to connect with others, and so you can either volunteer I am interested in, going on walks along the Schuylkill, and then anybody else who's interested in that, you meet at a designated time. It's free, but so you can look for things that interest you or present something yourself. For caregivers in particular, there's the LGBT Aging Center, which just has a lot of resources. It's good to just check out and get information. And the Family Caregiver Alliance is a national organization that is focused on supporting family caregivers. And they have various forms of support groups. And one is specifically for the LGBT community. And so these are telephonic, but they're also digital internet. Why can't I find the word? So yeah, that you can communicate in various ways, and then there are also physically local support groups. So CARES has support groups. There's an organization called SOWN, which is the Supportive Older Women's Network, and they do also teleconferencing counseling for homebound older adults. So you can just call right in. They also do in-person groups just for people that are looking to get together and connect with one another. And then they specifically have a group for Parkinson's care partners. So actually, here, sorry, we'll just move right along. Okay. So does anybody have any questions or thoughts? Or
Actually, I'm sorry.
So, do any of the resources that you mentioned that actually go to the house, are they for the person that needs the older person that needs a service, or are they for the caregivers?
That's a really good question. So overwhelmingly, it's for the person receiving the person who's more in need of services, the care receiver, the care recipient. So that's kind of actually why CARES started, because we couldn't really find any programs that were specifically for the caregiver. So in our case, the caregiver is the client and they're our sole focus, but it otherwise is kind of this afterthought.
So
Yeah.
can I just follow up on that? So if a caregiver, by your definition, is in social isolation, which means being in a state of being alone, right? Mm-hmm. What we're requiring in our system is for them to go out and find the help to not be isolated anymore, yet there's nothing that actually goes and tries to find them and help them not be isolated and not be part and be part of a global community, right? Does that make sense?
Well, so there is respite, which is right the idea of giving the caregiver a break, and that it depends on a whole lot of factors which type of respite you can receive. But the purpose with that is that somebody else is coming into the home, and that way that caregiver can get out. So are you asking, like, where is it that once caregivers can get out, where do they go, or just the option of getting
I'm
out?
talking about the first step. If you're a caregiver and your whole life is caring for this person, and part of that is what we're talking about is social isolation, right? Not being around people or said, or really being in a state of being alone, then what we're doing isn't we're expecting that caregiver to actually reach out for help instead of the other way around is bringing help to them.
Yes.
Okay.
Yes. No, but you're right on, and those are the two challenges right there, which is that it's, I think, kind of as there's a persona that often goes with caregivers, even though they're a very diverse group. But pretty much by definition, they are caring people that are focusing on someone else. And so, and kind of as Don was saying, that there is this whole complex emotional thing, especially with the guilt. And so often caregivers feel like if they reach out, it means that they've failed in some way, that they're not doing a good enough job. So that's definitely the first challenge. And then, as you were saying, then there's just the logistical part, right? So if you're someone who is ready to get out and get a break, how do you actually do that, right? It's expensive if you need someone to come into the home. How do you find the time? What if the person you're caring for is resistant, won't allow somebody in, right? There's a whole host of issues. So each case is,
Does the CARE Act, the C-A-R-E
Yeah.
Act actually help with that? Or does that, it still requires that
it is just like the
initiative from that?
smallest first step, which is that it recognizes that caregivers need to be included in the care plan and the discharge plan. So it puts a caregiver on file. Yeah,
Okay, got it.
yeah. It's something.
Yeah.
So
And you brought it up, respite care is where I was going. The secondary gain to the caregiver if they have someone coming in and relieving them.
sorry. I don't have any. Wait, what did you say?
Wait, you want to get that covered first?
Oh, well, okay. Okay, sorry. Okay.
Is there a strategy in place? I'm sure there isn't, but is there something of a strategy in place for what you're telling us to be the caregiver, or how we can go about the junction in our life where we are going to be cared for? What do we look at, and at what point do we start internalizing that process so it can work effectively for us when we get there?
Ooh, that is a very, very complex question. So how do you prepare for being cared for? I've got a few ideas, but does anybody else have thoughts on this one? Because I think that's a really, really profound question.
Sure. I would suppose as you get to a certain age, you will try to start taking care of yourself, or watching your diet, or getting up and moving around. I mean, if you're not getting any, nobody thinks they're going to get younger. So at some point, you have to think what the situation is going to be, so you kind of prepare for it.
I think, as much when you're isolated and it's so hard to want to join and be a part of the community, and it's tough. So, I mean, I work at the community center, and we have programs that are in place to engage people, speaker meetings. We go out to museums and stuff like that, and it's like that first step of getting somebody in. Because the whole point of our programs is to help people remain in community as they age, or to get them into the community as they age.
You mean the Elder Initiative?
The
Or
William
when you
Way
say
Community
we,
Center.
it's the we.
The William Way Community Center.
Oh, William Way, got it, okay.
So, but it's hard, and all these kinds of programs are just, I think it just brings light to the fact. So hopefully a caregiver sees this stuff or hears about it and takes that first step. But also on the if I could, also on the resource table was a book that AARP and SAGE together worked to create, and it's really a step-by-step way it's called Prepare to Care. A planning guide for caregivers in the LGBT community, and it has resources and guides, and in the back it's actually a workbook of how you can sort of sit down, even with yourself or with a friend that you may or your partner, and just make sure you have all your ducks in a row. But it's a good reference to have. So thanks.
Thank you for bringing that up. It is a really great resource. So it actually is one of our discussion questions, your question. So we will get more of a chance to go in depth. But if after that, I'd be happy to talk to you one-on-one if you want to. You, sir?
I'm sorry, I actually started my epilepsy. As far as the institute that they have over in the UK, which I mean, they're always advanced in the UK compared to us. But I mean, has anybody started a program here in the US for like a loneliness campaign? To have somebody like a little organization for that?
Not on a national level that I know
Local?
of. There are definitely smaller groups and programs, but the sense that the government is taking it on as a public health issue, I don't think we've gotten
I
there
don't think
yet.
it'll happen in the next 4 years, yeah.
I think there are a lot of other things that need to happen first. Maybe one last question. All right. Well, thank you very much. I appreciate your attention.
I'm going to bring up Danielle, who is the director of Active Day of Center City. She can tell you a little bit more about Active Day. So please welcome Danielle. There you go.
Hi, everybody. So nice to see this awesome turnout on a Saturday morning. So my name is Danielle. I am the director of Active Day of Center City. What we are is a medical adult home daycare program, and we're about a mile right down on South Broad Street. For the last 12 years, I've worked in some kind of facility that supports older adults, especially living with Alzheimer's or related dementia. And because of that, I spend a lot of time with caregivers. And what I know about caregivers is this: caregivers beat themselves up. Feel like if my loved one is getting support from someone that's not me, then I'm not doing a good enough job, or I am failing them. That is not true. Being a caregiver is not about providing every bit of care every hour of the day, because you can't do that. It's impossible. Even in facilities, there's a village of us every day that work together to help support our older adults, right? So the first thing as a caregiver, stop beating yourself up. You can't do it all, right? And I have sadly seen so many caregivers burn themselves out to the point of getting sick. Don't do that. You can't, it's so common that caregivers end up being the ones who need cares because they've sacrificed so much of their well-being for the person they love, right? There's a saying that I've heard, there's a saying that I use. Anyone ever been on an airplane? Yeah. You watch the safety video? What does the safety video tell you about the oxygen? You have to put the mask on yourself first. Say that to yourselves over and over again. You have to take care of yourself first, or you can't take care of the person you need to take care of. It's a hard thing, right? We feel like as caregivers, we need to be doing everything all the time. You can't do it, right? Who's caring for someone who isn't sleeping at night, right? When do you sleep? You don't, right? Because they still need breakfast. They still need to get their shower in the morning. They still need to get changed. They might take a nap during the day. What are you doing while they're taking their nap? The laundry, cleaning up. When do you sleep, right? You need to get supports so that you can care for yourself as well. So what are the supports, right? Anyone here feel like if they get help, they're not doing enough? They're not the caregiver anymore? Yeah, right? That's a feeling. But you can't, right? Even me, someone who cares for someone 12 hours, cares for a group of people 12 hours a day, there's a team of us. We all have different responsibilities and roles. Doesn't make me any less of a caregiver than anyone else on my team. We're all doing the same thing. All right, so what are some of the options? And to your question in the back before, it's a hard first step, right? One of your first steps should be calling PCA, right? And I know people are scared of PCA for a lot of reasons, but they do have a lot of resources. One of the first options is home care. You can have someone come into the home and help you support your loved one. Maybe they're doing the laundry during the day and washing the dishes, or maybe they're doing that shower in the morning so you get to take a nap, right? Just a little bit. Or maybe they're covering the overnight so you can sleep. Maybe you just hire someone who shows up at 10 p.m. and leaves at 7 in the morning, and their job is just to make sure that your loved one is safe so you can sleep, right? Simple thing. The next option is adult daycare, which is what I do, and I'll get back to that. Yes?
Is that free daycare?
So, yes, it can be and it might not be. It really depends on the person's finances. If they own property, what their assets are. So if a person has less than $8,000 in assets and their Social Security or their income is less than $2,200, they may qualify to be on the Medicaid waiver. If they do, yes, most of this is free. So, you want to start with finding out, does this person have less than those assets, and do they have less of that income? And back to the question about when we become caregivers, it's really important to start early to work with a geriatric attorney, or what do they call it? Elder care lawyer. I'm sorry, I'm losing it. Elder care lawyer, because they can help you figure out where to put your money, who to pass it off to, so that you can get it. I was once told by a elder care attorney that even the most rich person in the world, if they properly manage their funds before 6 years before they need the care, can get on waiver. So talk to an elder care attorney. Yes?
It's one that elder care attorney. If you don't have one, chances are you're not going to get a waiver.
Yeah. You have to. You really do. You're right. Yeah, which is tough because they cost money. There are some that take sliding scale. There are some that just...
You can in your property. That doesn't come into that.
Well, if you pass it off before the 6-year look back. So, and I just learned it was 6 years. It used to be 5. I just learned this last week, earlier this week. All right, so some of the other options, there are personal care homes, right? And a lot of people, again, caregivers who want to keep their loved ones at home get very nervous about that idea, but personal care homes is an option for someone who does have some finance, some money that they can spend on a personal care home. And then there's also skilled nursing centers, right? I think a lot of people's goal is to continue to care for their loved one at home as much as you possibly can. And I like to think that that's where our program comes in. So we're a medical adult day program. And basically what that means is we're a nursing home, but you get to sleep in your own house at night. So if you come into adult day during the day, you get physical therapy, you get occupational therapy. There's an RN who's checking your weights and vitals. You're singing with the music therapist. You're going across the street to Pep to go bowling and up the street to the Broad Street Diner. Someone's helping you walk to the bathroom. Someone is there to give you a shower, even at the center if you need it. So a lot of my caregivers who really, really refuse to put their loved one in a nursing home, want to do it all, but are struggling, maybe even just bring their loved one 2 days a week. So for that 2 days a week, they can read a book, they can go shopping, they can take a bath, they can just take 6 hours or 8 hours in one day just to breathe. So that's pretty much what adult day is. And some folks do use us 6 days a week so that they can work. So it's really, one of those, it's an option, right? So the next scary thing is, and like I said, caregivers beat themselves up and know they can do it better than anyone else is. So how do you trust someone else to care for your person, right? How do you know which facility, which person coming in is the best, right? Anyone worried about that? Yeah. So just a few tricks to tell, is this facility somewhere I feel safe sending my loved one to? So the first thing is do your research ahead of time. Go on Google, read reviews, make a list. I'm a big spreadsheet person. I'd have a spreadsheet. Facility, how many stars? What do the reviews say? You can go on the state's website and look at their state inspections, and I recommend you do that. Most facilities are going to have at least 1 or 2 inspections. What are those citations? Is it a major citation? Is it a minor citation? Did they address it properly? And then the next thing is take a tour. But here's the thing, don't call them and schedule, show up. Yeah, don't tell them you're coming, because when I was looking for places for my grandma when I was younger, I went to a place, they're like, oh no, we're not prepared to show you. And I was like, well then I'm not prepared to bring my grandma here. Absolutely not. You should be able to go in anytime. Go in at the most annoying time for them. If they can't if they don't let you in and give you the opportunity to look around, a good place will say, I am so sorry, I am very busy right now. Would you mind just sitting here and watching? And I'll be back with you in 20 minutes. If they're not comfortable with letting you see what's going on in their facility when they're busy, it is not a place you want to be, right? So the next step is look at the calendar, look at the meals. They're going to tell you all the great things about their facility. Yeah, it's wonderful. Did you see our chandeliers? So they all have these great chandeliers, and they want to show you their fancy chandeliers. Don't look at the chandeliers. They'll distract you with them. What you need to do is look at the staff, right? Is the staff smiling? Are they talking to the members? Do they look engaged? Do they look happy? Do they look like they want to be there, right? If the staff doesn't look like they want to be there, you don't want your loved one to be there, right? And then next, you want to look at the people who are participants. Do they look happy? Do they look engaged? Do they look clean? Did they eat lunch at, is it 2 o'clock and you're just now realizing that they're covered in food and no one is bothered to help clean them up or take their apron off? What do the members look like? So during these tours, they're going to kind of try to talk to you the whole time and kind of shuffle you away from things that don't look good. Those are the things you should pay attention to. Don't listen to the person who's talking. Look at what you're seeing around the facility. Does it smell? Is it clean? Does the food look like something that you would like to eat? And then ask for a free day. I just want my loved one to spend a little time here. And don't stay with your loved one. You're going to want to. But you need to know if they can do it on their own, right? If you're there with them, they are going to cling to you and they are not going to participate in what's going on at all. They are just going to stay by you, right? It's no different than if you go out to a restaurant you're going to want to be with someone, right? You might meet new people if you're alone, but if you're with someone else, you're just going to talk to the person that you're with. Okay, so who thinks the person I'm caring for will never agree to this? Just one? I don't believe it. All right? I'm never going to do this. The person I care for doesn't like to be around other people. They don't like arts and crafts. They don't want to be around other old people, right? This is what we hear all the time. I have, a 98-year-old woman walk in. She's like, oh God, no, I don't want to be around these old people. All right, well, right? No one wants to come to my program. No one. And every family member tells me my loved one is going to hate it here. And I tell every family member for a week. They will absolutely hate it for a week. But slowly they start talking to the lady next to them who's like, yeah, I hate being here too. And over time they make friends and they gossip about the other people. Let me tell you, older adults, I remember when I first started working in this field, I was like, can't wait to get away from catty high school and college people, please. Older adults are the cattiest group. But yeah, so they make their little cliques and they make their friends, and in a week or two, this is a place they want to be. So you just got to try it. And not for them, for you, right? Because you need to take that bath, to take that hour to read that book, to go out to dinner with your friends, to do something, to just have a moment for you. Because again, if you don't you have to put your oxygen on first before you put it on anyone else. And then, the staff, if it's a good facility, the staff is trained to know how to help someone adjust. I've never had anyone not adjust, because when I'm doing that intake assessment, I'm thinking, oh, He'll love to sit at the table with Mr. Smith and Mr. Jones, or she'll fit in great with these chatty Cathys, or she's kind of quiet, so she might be better off with this group. Or we look at cognitive level. Someone's high cognitive, we want to match them with other folks who are cognitive. So we're doing that at facilities. Who will this person fit in with? So trust the staff there. Last thing, just keep saying it over and over again. You can't take care of someone else if you're not taking care of yourself. And just because you are not caregiving 24 hours a day does not mean that you are not the primary caregiver. It's okay to give up a little bit of that. Any questions?
I feel like we're sitting in the park, right?
Yeah.
And I don't feel like I fit. I don't feel like I fit in there.
Yeah. So there's,
like you said, it's a bunch of old.
but you know what? There are other facilities. There are other programs. There are other groups. Go back to the drawing board. If Center for the Park doesn't work for you, don't go there. Yeah, I know. But hey, we all know CCT is not great, but it does allow us the opportunity to get around the city. So you might have to spend a little more time on that van, but it's worth it to find a program that works for you.
So I just wanted to say that what would be important for me is that the facility I'm looking at is culturally competent, LGBT culturally competent. So I just want to know, has your agency undergone cultural competence training, LGBT cultural competence training? Because I know that we have a whole bunch of unique needs, and we face a lot of discrimination and harassment in these facilities because the staff just has not come up in times. So I would include that in looking at a facility. Have they undergone LGBT cultural competence? Because the people I'm caring for are queer. So just to say that, and the other thing I wanted to ask is, you started off and you said something about fear and PCA.
Yes.
And I'd like to ask you, what is that? What is that?
Often people are afraid to call PCA who own homes. They're afraid that PCA will try to take their house. I hear it all the time. I won't call PCA because PCA will take my home.
Really?
Yeah. There's if someone does own a home, there's you can still get waiver services, but there's sometimes a state recovery piece to it. So often people are scared to call PCA for that reason. Yeah. And back to your previous question, Serena and I did discuss this earlier. I mean, the first thing is, anytime you go in, you should tell them exactly what you want and what they need, and if they don't respond appropriately, you should leave. Serena and I did talk about this earlier. I promise I'll get to you. We have a list of trainings. Sadly, that's not on there, and it should be. And different facilities like ours, we do address it. However, there should be a list, and we did talk about this. Maybe there needs to be a program that even this group provides, where we can kind of on the website or somewhere okay, this is a certified program that we feel, and that something that maybe is, something that would be something great for the city or someone to do so that you would know.
There are organizations that do cultural competence.
Like Sage Sage does it,
I don't know if they do it. Do they do it for residential?
Yeah.
They'll do it for anyone.
They'll do it for anyone?
And Terry does that, right?
Terry Clark.
Yeah, she's a doll. I work with her on a bunch of other things, so yeah. Okay, so go ahead.
You gave some great information for evaluating places for patients to be inpatient. But what about all these agencies that provide home care? Because I've had really bad experiences with a lot of them, where the person they sent was culturally not competent, but also they just want to do the minimum they can get away with.
Honestly.
And not really do, and I've had wonderful experience. One agency that I recommend to everybody is called Pan Asian Senior Services. Right. And they're fantastic. Yeah. They're the best homemakers I've ever had. But from some other institutions, I have some really bad. I had a person who didn't want to clean the bathroom because I'm HIV positive, and I thought, how's that going to make you positive?
Right.
And you know, they can't answer.
Sadly.
I had another one say she couldn't vacuum because she had a bad back. And I said, well, then you need to call your out today and go home.
Well, you know, it's going to sound like I'm selling because this is the business that I work in, but a lot of my day is going out to assess new people coming in, and I can't tell you how many times I walk into a facility and there is a caregiver, a paid caregiver from one of the companies sitting on the couch watching Hoda and coffee, texting on her phone. Drives me insane. So that's why I do recommend a service like mine, because there's a combination of the caregiving and the activities and the support. So they're getting out, they're getting engaged. There's a lot of caregivers and there's a lot more going on over home care. You know, there are over 100, maybe over 200 caregiver companies in the city. You know, again, it would be good to be able to narrow them down and start a list of these are the ones that actually know what they're doing. But yeah, caregiver companies, it's tough. Once you find a good one, let me tell you, hold on to them. And do you know about the Caregiver Support Program? So if you are a caregiver and you are on waiver, or your loved one is on waiver, they can get paid by their caregivers of your choice can get paid to care for you. So that is an option.
Another really good resource.
Oh, not caregiver support. That's
Yeah, that's just waiver.
right. It's got a name.
But the Caregiver Support Program is a reimbursement program. So if you want to get paid for your loved one, then you have to be on waiver. But if I wanted to, if I'm caring for a parent and I want a break, and Danielle's my neighbor, and I'm going to pay her $15 an hour to come and stay with my mother 3 days a week, and I'm paying her out of pocket, the Caregiver Support Program will reimburse you for what you paid back. Oh, but then.
Well, I think that's the same. Yeah.
And another really good resource for people who don't want to deal with PCA is called Supports Your Way.
Yeah, I've worked with them. They're good.
They're fantastic.
Yeah, it's similar. It's a similar concept.
Yeah.
And so another thing.
Unlike PCA, they don't lie to you. PCA frequently lies to you in telling you that either you don't qualify for something or they don't have it. So they told me I did qualify for mom's meals, but the person at PCA Supports Your Way said, of course you qualify, and she got it for me.
So part of it right now is the city is going, or the state actually is going under some transition. It used to be that you would get enrolled under waiver through PCA, but now there's a third party called Maximus that is doing the enrollment. And then after you go to Maximus to get your waiver enrollment, you can choose from any of the number of supports coordination agencies, which PCA is one of them. I'm sorry. Oh, wait.
Maximus
Maximus
uses PCA to do the eval.
Correct. That is true.
That is
All of the assessments are done through PCA. But we're changing over to managed care, which is going to be a little different. We're going to have to wait and see, unfortunately.
I have two questions.
Yeah, so a lot of you can get a CNA license. There's CNA schools. But also a lot of these, if you're approved for this caregiver support program, you choose an agency and that agency will train you.
Two things. If I was going into a facility, I would look at two additional things. One is nurse to patient ratio.
Oh, I should have brought that up. Yep.
Second is security.
Yeah.
And I have two questions for you too.
Yes.
One is the personal homes. Is that there a list on the resource?
Personal care
table
homes?
of personal care homes?
Yeah.
There is? Okay.
Well, I don't know if there's a list on the table, but you can get it. They're like your sunrises and your...
Okay. And secondly, long-term care health insurance.
Yeah.
Recommendations of companies.
I unfortunately don't, and I know that in recent years the policies aren't as good as they used to be. I don't, unfortunately. Yeah, and they're not as good as they used to be. I don't have an answer to that, unfortunately.
Do you know someone who might know that?
I can look into it.
Prudential is one you might want to look into. Prudential Insurance. They sell long-term care insurance.
Hancock also.
And I used to work for them, so you might want to see if you get some information from them about that.
So is that maximum support or maximum care?
It's you can Google PA Independent Enrollment Broker, and the phone number will come up.
AARP also offers.
Oh, AARP, there you go.
Maybe one more question.
Okay, one more question.
This is just a technical question. When you said that someone's on waiver, what is that? I don't know what that means.
So it's Medicaid, but instead of paying for a nursing home, the waiver is so that you can still stay in the community and get services like daycare or home, someone to come into the home. So it's our goal, our main goal as an adult day program is to keep people in the community. Yes, you might need 24-hour care, and you can get all of those things, but still go home at the end of the night. Still go out to dinner with your friends and your family and your partner. So that's the purpose.
And is that what a waiver is, or?
Yeah, it's to waive going into a nursing home, but you can only do that if you're Medicaid eligible. Otherwise, you have to pay privately.
Okay.
If you look at one of the waiver that also covers and the medical costs, because if you're accepted with the waiver and you go into basic disability, it covers everything.
Yeah, it does cover, the waiver does cover a lot. I don't know specifics other than it does cover our program, home care, those sort of things.
Workers' medical one covers 100% of that.
Yeah, not bad, right? All right. Thank you all so much.